This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Hello, everyone, and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to have two guests with me from the health unit here in Grey Bruce. Actually, it goes by a different term now, I understand. It is public health. We're talking about healthy babies, healthy children, and the program. And we have with us Janet Kwansah. Hopefully I pronounced that right, Janet. Janet wears two hats, I understand. She's here certainly for the public health manager role in Healthy Babies, Healthy Children, but I also understand you're the chief nursing officer as well, and Susie Frooke, who is a public health nurse. So welcome to both of you. I am absolutely delighted that you're here, and I'm also very, very glad to have had the questions in advance. We were chatting just briefly before the program about those. So thank you both for being here on the program today. So let's get to the first question. What is the Healthy Babies, Healthy Children program that you currently offer?
Yes, so the Healthy Babies, Healthy Children program has been in existence for about 27 years. It started in 1997 where the government funded the program, and it introduced it in phases. So phase one, which was under the Ministry of Children, Community and Social Services, was limited a bit in scope because it catered for children from birth to age 2. The program has evolved over the years to what we currently have, serving a broad range of families, and we'll go into the those who are qualified to join this program. So it's a voluntary home-based visiting program, which is designed to support families who may carry a lot of stress due to life circumstances. And they sometimes feel they don't know where to turn to for help. So we provide them with information and advice around pregnancy or their growing child. So the program also aims to improve prenatal and birth outcomes, parenting capacity, parent-child relationships, child development outcomes, and social capital of parents, which will include parental health, educational attainment, and housing stability as examples. It's family-centered and strives to build strong relationships with both families and service providers. So this program is also based on the premise that families and communities share responsibility for children's healthy growth and development. So you realize that in our program, we partner and collaborate with a lot of community agencies and partners who are also in the same business as we are in terms of supporting the healthy growth of children. So the program also recognizes that families can move from relative health and strength back to need and then back. So as a result, what we do is the program is tailored to meet individuals where they are. It's not a one-size-fits-all program at all, and we'll talk about what we do when we meet with the families. So our Healthy Babies program team is made up of very experienced public health nurses, and we also have parent support workers who work in partnership with the public health nurses to provide the needed services for our clients. So I think I will hand over to Susie. I'll hand over back to you.
Go ahead, Susie.
Okay, so I was going to just give a little bit of a context to why we do what we do. So one of the things I wanted to start with is chronic diseases are the leading cause of death in Ontario. So over 7 out of 10 deaths reported in 2015 were due to chronic diseases like cancer, heart disease, respiratory disease, diabetes. We're all familiar with that. So that's significant. It's very costly to treat, but chronic diseases are also what we know largely preventable. So taking the steps to prevent chronic diseases starts early in one's life, often in the womb, and can lay down a solid foundation in the early years of a child's life. So there was a large study called the ACEs. 17,000 participants. It was huge. It's the biggest one of its kind. So ACEs stands for Adverse Childhood Experiences. So it was conducted in the early 90s. And what it did is it looked at traumatic childhood events and how they negatively affected adult health. The study explored child maltreatment. It explored family dysfunction and the current health status of the participants and some of their behaviors. So the study found a direct link between childhood trauma and adult onset of chronic diseases. It also found more likely for this adult to be incarcerated, to have poor academic achievement, and employment challenges. And here's the thing too, early death by 20 years. So it's pretty significant findings. So experiencing ACEs, the adverse child experiences in childhood, for example, poverty, violence in the home or community, racism, abuse, neglect, divorce, separation, incarceration, mental illness, substance abuse, high conflict in the home. Those are all those things that they were looking at. Unsafe neighborhoods. It activates a child's stress response because these are stressful events for a child. We kind of forget sometimes as adults, a child's world is fairly small. You know, it's pretty simple. We get used to adults juggling many things. We wake up in the morning and we already have 20 things, bills to pay, the kids to get off to school, all those kinds of things. A child's world doesn't have that. It's very small. So these things can really activate that stress response in a child. So just to make it kind of a little relatable, the stress response in children, it kind of can be compared to, let's say, revving an engine in a car for days or weeks at a time. And what this does is it leads to toxic levels of our stress hormone system that creates long-lasting wear and tear on the body and brain, which will then lead to the breakdown or lead to, guess what, chronic disease development. So that's what the study kind of unpacked. So now that we know all that, there is some good news. The antidote, because we don't want to just leave it at that, like, oh, well, we're doomed. We are not doomed. The antidote to ACEs is connection. Relationships matter. Relationships with humans. We do need each other. So safe, healthy, and supportive caregivers who can foster strong, responsive relationships with their children will protect and act as a buffer against the negative impacts of ACEs and toxic stress. So children need that safe base to live where there's trust. They can feel vulnerable and make mistakes without judgment and criticism. There are clear routines, clear expectations. There's guidance and teaching. There's boundaries that they depend on. And when they have all of these things in place, then that decreases the stress, because remember, like, stress over time, when it's chronic, when that engine is revving for days and days on end, it becomes toxic. And when that toxicity is what leads to these chronic diseases. Or when I talk about the academic achievement, if you think when all of this is weighing on a child's brain, when they go to school, and even as adults, we can relate to this, how much can you concentrate when you have so much weighing down on you? You can't hear the teachers. You can't even go home when there's that unpredictability, that feeling of not being safe. How can they get their homework done when there's that type of environment? So it's really, I always feel it's very important to recognize children can carry a lot of stress and anxiety, and we don't even know it just by simply looking at their environment. So what we know, years ago, there was a study, the mustard study, which is the early years. Early years really matters. When we think about brain development in the prenatal period, when, let's say, there's exposure, a mom who's carrying this baby has a lot of stress, again, revving that engine becomes toxic, that blood that's circulating and developing that baby's brain. Again, we're not sure, does it create some unhealthy neurological development with that exposure in utero? And then when they're born, a mom, father, caregiver, lots of stress, that baby is going to feel that, even though we try very hard to hide it, because all parents love their babies, love their children. We try to put up a good front. But they feel it. They do feel it. So early years matters. It really sets that foundation in their brain development to either develop some healthy pathways as it develops, or it can develop some unhealthy, because it's trying to adapt. The brain always wants to survive. And so when there's some adversity present, the brain will sometimes say, okay, if I can't go left because I'm being blocked, it's stress, there's problems, I'm going to take a right and I'm going to go over here. And when it goes in an unnatural path, then we would call that a maladaptive sometimes behavior, where maybe there's some self-regulation issues that ends up being developed, even though we don't mean to. It just is how that child's brain adapts to those stressful situations and those stressful moments. So that's kind of we always recognize and want to unpack with parents, where did they come from? What happened when they were little, and what's going on currently? Now? We really want to look at those ACEs because it just helps us help them and help their children reach their most optimal development. And knowing those ACEs, it's not a life sentence. We can work with that, and we can help get those buffering systems in place for our families, so that as long as that buffer's there, you can have lots of ACEs present. But if the buffering is there, then it softens and they actually can thrive and do very, very well, as long as we have those buffers. One of the things maybe I didn't unpack enough is some of those buffering systems. Well, I say it's like a healthy, safe, and supportive caregiver. That can mean also a community, a safe community, a teacher, the school system. Those can be buffering factors. A babysitter, a grandparent, just someone who can foster a relationship with that child can also act as buffering systems. And of course, like even us, our program, we can be a buffer for families to create their own, to reduce those effects of ACEs.
You've really provided some key learnings for me. What I'm hearing you say is we often think of chronic diseases as in older people, or over time. And you're saying chronic diseases happen in youth, like the the stage is
Starts early.
set. The stage is set early, and that's a light bulb moment. I mean, I understand what chronic disease is, but to recognize the impact of stress and nurturing and that's really, really important. And the other is that parenting, we assume, is with parents, but you're also saying that communities have a role in nurturing the well-being of children as they grow up as well, that communities matter. And, I think that's really some other information about how to get people into the program. But you've both been with this program for a while, I'm assuming. I didn't ask at the beginning, but if you don't mind sharing, each of you. And are you seeing changing trends? So I'll open that up to either one or both of you who wish to answer that.
I can jump in really quick just to add a little bit more with what you said. It does take a community. It does take, I hate seeing when it's just one person who feels like they just want to raise their child. We need multiple people, multiple caring and safe people to bring into a child's life. And so I think that is important. And one other thing, without getting too technical, when we think about brain development, the first 2 years, that brain, the neurons in the brain are really developing. And I always explain to parents the way when you think about, chronic diseases leads later in life, the brain is almost like a gravel road. And when you drive on a gravel road, when you go on a really busy gravel road, over time, that gravel packs down and it gets actually kind of smoother when you drive over it over and over and again. And it gets smooth. And when it gets smooth, you can drive faster on it. And the brain works the same way. And eventually, maybe that busy road actually gets paved. And when it gets paved, you can actually drive super fast on it. And so the brain develops in the same way. In the first couple of years, it's actually really important for parents to respond in a very predictable, consistent way to provide those boundaries, that love, that trust. A baby, when they're first born and they're crying, Mother Nature has designed babies to cry to alert their caregiver to say, I sometimes don't even know what I need, but I'm going to cry because I just don't feel safe right now. Someone come and get me. So when that consistent caregiver starts to teach that child, when you cry, I've got you. I'm going to scoop you in my arms. I've got you. That is driving on that gravel road that's really bumpy. And they're going to have to do it over and over and over again. But the more they do it, the more it gets smoother. The faster those neurons in the brain start to work. That leads to self-regulation, right? And so the faster a child, when they have a meltdown, when you're in Walmart doing shopping and you told them, no, you can't have that chocolate bar, when they're very young, they're going to probably cry and really have that temper tantrum. But when you see that same child at 6, they might whine, may cry for 30 seconds, but when you've been very consistent in providing rules and rituals, they're going to self-regulate super quick because that pathway has been driven on over and over and over again. So that we want those healthy responses to be driven on lots and lots. There are going to be some unhealthy things that might happen, but if they're not driven on a lot, those neurons get pruned away after age 2 to 6 and they go away. Mm-hmm. So that's all I want to say. Sorry about I'm going on and on. I've been doing this for 23 years. So quite a while. I'm very passionate about this work. I love it. It makes sense. There are so many great things that really, I love tapping into our instincts. We are born with a lot of instincts. And sometimes if we almost micromanage, especially our babies, too much, we kind of go against all these beautiful instincts that both a mother has and a baby has. So anyway.
Yeah. So
That's good. Janet, you.
yeah, no, recognizing the importance of community has kind of made us now more aware, and as a community, we are focusing on building communities' resilience to be able to support and manage the adverse effects that children who have gone through ACEs are facing even in adulthood. So that's something that is ongoing as a community, and we are working towards that because we can't do it alone. Even as a health unit, we need all the other players to support. I've been in public health for about, I'll say, about almost 10 years. In different roles, including healthy growth and development, and I've managed healthy babies, healthy children in total of about 4 years. But I am very new to Grey Bruce public health.
So families or individuals, grandparents, anyone watching this program, how can people get involved? You know, if you may want people to know how to connect with you. So tell us how to work through the process.
So our program is, like I said earlier, open to individuals experiencing stresses in their life who are pregnant, so at the prenatal stage, and also those who just had a baby, so the postnatal stage from birth to about 6 to 8 weeks. And then those who also have children who are not yet in school. So these are the families, the individuals who are eligible to join our program. So it's through referrals from health providers, and also individuals can actually self-refer to the program. And we get most of our referrals postnatally from the hospitals and the midwives. And also, like I said, individuals can self-refer to the program. Yeah. So for the prenatal stage, we call those the early referrals because it's very important to get them early, provide the necessary support and tools for them to use so that by the time the baby is born, they are well equipped to manage the stresses that come with childbirth. So there are different community programs that we facilitate referrals to. These include Healthy Beginnings, Pregnancy Center, prenatal education, mental health. So like I said earlier with the program, it's a partnership. It's a collaboration with the public health nurse and the parent support worker. So we link the parent support worker to the individual to support them to make appropriate connections and relationships within the community. And then for postnatal, so from birth to about 6 to 8 weeks, we work with the families to help them understand themselves, their infants, and for them to be able to better respond in an intentional and loving way to their children's needs. So our primary focus at the postnatal stage is on caregiver relationships, building relationship building, and also infant mental health and strengthening the positive wiring in the baby's brain. Like Susie mentioned, that the brain is wired, but we need to ensure that this wiring is positive and eliminating the negatives. And then we have the early identification phase, and this is from the after postnatal all the way till the child enters the school system. So parents, we provide support like nutrition education, addressing behavior issues, because those are the times where parents really struggle with child behavior. And then, so this is all also to prepare them for school, so that by the time they get into the school system, they've built these positive relations and attitudes.
Yeah, excellent. So, as I hear both of you explain the program, you really act as community and service provider connectors as well. Yeah, I mean, you provide the in-home, but you connect families and children to the services based on your assessments. I know we've only got about 2 minutes left in the program. I cannot believe how quickly it's gone by. What important information would you like to share in the last 2 minutes? I know I could talk to you for a long time, but what would you really like our viewing audience and our listening audience to know?
I can maybe just chime in. I think the important thing to know is that we don't want families struggling all on their own. I sometimes tell my families, I'm another brain in the mix. I go in and work with families. I don't necessarily, they're the ones who have to do all the work, really. I'm going to come in, do some assessments. I have some ideas, but really they have to drive what they want. We create some mutual goals. I can maybe bring some information to say, have you ever thought about this or this? But they really have to drive. I'm just there to walk alongside them and just help them a little bit, because there's lots of barriers set up for families. And there are lots of times where they just don't even know where to turn. And sometimes I'll meet a family once and say, hey, all you need is, here's a phone number, here's an organization that you could probably help. And sometimes it's as easy as that. So I don't want families to just feel like I'm all alone, I'm struggling here, I don't know what to do with my pregnancy, my baby, or my child, my toddler, I feel my toddler's out of control, whatever. I don't want you to struggle with that, because we can definitely just help steer in the right direction, hopefully. Our program is also very kind of hands-on, especially with our parent support workers. I couldn't do my job without them. We're really a team. And so while I can do the assessments and look at some interventions, I really depend on them to actually go and do very hands-on work with the families.
That is an excellent summary. And for me, the message is reach out for help. Reach out to your health unit, give them a call, talk to them, because they're there to help. I have so appreciated both of you being on this program today. I've learned for sure, and I'm hoping that as a result of the program, others will connect as well. Thank you both very, very much. And thank you to our viewing audience for joining us today. To learn more about programs, resources, and services available to you and to your family, take care and stay safe. Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
Growing up, I was surrounded by violence. I had the drive to pursue education, but I didn't have the means. I couldn't afford to, because the child welfare system is not enough to support youth who want to go into higher education.